having the capacity to go straight from the delivery room down to the cardiac intensive care unit, having all the specialists right there ready to take care of your baby is made all the difference in the world as far as outcomes for this particular heart defect. As recent as the early 2000s, in my experience, some cardiologists were recommending no therapy for the NORD procedure because they had been so discouraged about the outcomes in parts of the country. In a study also in the early 2000s, late 1990s, more than half the children with this that went through the NORD procedure died. But the outcomes that have improved exponentially in the last 10 to 15 years, to the point that now more than 90% of children will survive this and go on to the next surgery. And about 80% of our kids that go through our program are going to survive all 3 surgeries and live out to 4 or 5 years. Now that's very early on, but once you get through all 3 surgeries, the chances of you going on for many years after that is very good. Kids can go on and do normal things after these stage surgeries. They can play competitive sports. They can do normal. They usually have fairly normal intellect and IQs. But this is a very, very difficult process. Kids that are born with this sometimes have other issues. They sometimes have genetic problems. They sometimes have neurodevelopmental delays. And that's why I think that the multidisciplinary care is so important, so that we can address those other issues very early on. We can help them in school. We can help them be as good as they can possibly be. We put out our outcomes for people to see because we expect and we want them to know exactly what they're going to get for their child's care.